Hey there, it's Dr. Appalraju and welcome back. Listen, today I wanted to talk about something that most people don't really know. Perhaps most physicians or maybe cardiologists might not even know. So back in 2019, I had the opportunity to fly to Toronto. I took a overnight flight, arrived early in the morning, and all day I listened to two people who have a clinic, and they manage patients, especially to prevent heart attacks and strokes. And they run their program out of Spokane and also out of Texas. And it's become known as the Bale Doneen method. Now, they've written a book and they've published some studies. And they're one of the few places, if you are a patient, and you suffer a heart attack or stroke, they will refund you money. Now, point being, they have a systematic way of managing patients and preventing heart attacks. It's all about prevention, even with dental care. Now, I am not a physician, and certainly physicians go to different programs and different teachings. And one thing we do know is underlying a lot of what physicians will follow in terms of their protocols with regards to cardiovascular disease is called the Framingham studies. And these were done in the 40s or 50s, and they've tracked patients for many years, and they look for various risk factors. Now, some of the data in that is not up to date. And so, we have some education and learning. Now, I sat down because I bought this book. Bradley Bale and Amy Doneen wrote this book. It's called Beat the Heart Attack Gene. And one of the fascinating things I'm found in this book is there are a number of factors that we need to look at, lifestyle factors, and these are simple, but they're also hard for us to look at. Certainly, you want to look if you have a risk in your family of heart disease, and you're not just looking at your immediate family members like brothers, sisters, or your parents. You need to be looking a little bit wider. And if there's uncles and aunts and such that have had a risk, you are at a higher risk of having a heart attack and a stroke. And quite often, we think we're invincible, and the data shows that most people, when they surveyed Americans, if you're in Canada or any other first world country, well, we seem to believe that we're healthier than we are, when in fact the data doesn't support it. So just be aware that sometimes we kind of live our own deluded, within our deluded consciousness. So what I really wanted to point out in this particular episode of a Concept Dental Moment is the data that they have compiled in this book. Now, I haven't finished the book, but I wanted to share this with you because one of the things that struck me was women and heart disease and how underdiagnosed this is and how many women are actually dying. We hear a lot about cancer, breast cancer, and all these fundraisers. But what I was surprised to find out was that more women die, roughly 10 times the number of women die of cardiovascular disease, heart attacks and strokes, than of cancer. And that was staggering. That's a huge number. I just wanted to share some data that I found here. And these were based on studies that the American Heart Association had done. So one of the things that tends to happen is, and they've got case studies in this particular book talking about women that had heart attacks, went to the hospital, and were misdiagnosed. They thought it was some infection. They thought it was something else. They were sent home, and it was minimized, unfortunately. And luckily, these women did not die. They managed to go back, and then it was diagnosed. But it was not picked up early, unlike men who have these typical symptoms, of left-sided pain, chest pain, impending doom, jaw pain, that type of stuff. Women don't tend to show those. And I'll share that in a separate video, the atypical symptoms that women have. But what I wanted to share with you on this post, to try to keep it a little bit down, was the fascinating data, what they showed So on this particular thing, this is regarding women. So after a heart attack, women are almost twice as likely to die than men. And compared to men, women receive much less treatment for heart attack and stroke, meaning beta blockers or told to take aspirin. And even women who are eligible for life-saving clot-busting drugs are far less likely to receive those than men. Again, it's all because the healthcare system is set up, and we're probably thinking that women don't have as many heart attacks as men, which is probably rightfully so, but they have a lot more than we think. They also document here that women's heart respond better to men's regarding healthy lifestyle changes. So but the problem is women are less likely to be referred to these programs by the doctors in the healthcare system. And also, women with heart disease receive much fewer procedures, such as balloon angioplasty and bypass surgery to, get these blood vessels in their heart opened up. They also document that women are also less likely to be referred for angiography, which is detecting those blocked vessels, than men. And women are only comprising about 24-25% of the participants in all health-related studies. And so their point is that there is a definite gap between women and how they're perceived and treated in the healthcare system compared to men regarding heart attacks and strokes. And so there's definitely a gap to be closed. It's only going to get closed with education and awareness. So if you do have a family history, and look at a big breath in terms of your family, not just looking at the immediate. If you're a smoker, if you are a little bit overweight, you have a larger midsection. Typically, they would measure that, for men over 40, but I believe for women, it's over 35 inches. You're already at a higher risk. If you smoke, much higher risk. If you have diabetes or pre-diabetes, your risk of heart attack and stroke is much elevated. And the one thing that a lot of people don't realize, and they document it, this is why I actually went to Toronto to listen to these speakers, is they were talking to a room of hygienists and dentists, and very unbeknownst to a lot of people that if you have gum disease, or you have gingivitis, gum disease, or we call that periodontitis, you're at much higher risk of getting a heart attack and a stroke, and their data shows that. So just wanted to educate the people watching this. If you have some family or friends that are higher risk, some of those factors that I just mentioned, perhaps share this video with them. This is a great read. You can pick this book up on Amazon. That's where I got it. It's a fairly easy read, and I'm trying to show it to you here, but my thing is not showing. It's called Beat the Heart Attack Gene, and it's by Bradley Bale, is a physician, and Amy Doneen. So certainly something to look at. They will speak about prevention strategies and lifestyle strategies that you can change. But if you have a strong family history, get educated, learn about the stuff, because heart attacks and strokes are pretty much the #1 killer in developed countries. So learn if you're at risk and if you have inflamed blood vessels. And there's lots of reasons that you want to live a long, full life. And as my background says, you have one life, live it well, get educated, and take some action. I hope you found this post useful and not distracted, but stay safe out there and keep well. And hopefully I'll post again with the factors for women. What happens when they have heart attacks and why it's underdiagnosed, the symptoms that women tend to experience. It's slightly different than men. Take care. Stay well, everybody.